Welcome to the presentation of the patient case report concerning immediate latissimus dorsi pedicle flap reconstruction following the removal of an 8-kilogram giant phyllodes tumor of the breast. This assignment is done by SF Shah, SF Mpaka, NZM Mia, SLK Matsimela. SF Shah will be discussing diagnosis and treatment. NZM Mia will be discussing etiology, discussion, and introducing the topic of this patient case report. SF Mpaka will be discussing disease progression and pathogenesis, and SLK Matsimela will be discussing investigation, clinical manifestation, and will be concluding the presentation.
Introduction. Giant phyllodes tumors are the type of tumors that are more than 10 centimeters in diameter. The World Health Organization recognizes the phyllodes tumors as benign, malignant, and borderline. They are mostly known as benign tumors that can develop into cancerous neoplasms that can be treated with radiation, therapy, hormone therapy, and chemotherapy. There have been previous cases recorded with similar phyllodes tumors, but it is the first case where the area of incision was covered by a latissimus dorsi flap, an entirely different approach in terms of reconstruction. Phyllodes tumors are uncommon fibroepithelial tumors that are often mistaken for fibroadenomas. These tumors are known to target the connective tissue of the breast in about 0.5% of all women above the ages of 40 and upwards. Giant phyllodes tumors account for about 20% of all giant phyllodes tumors. Even though the huge tumors have been recorded in the past, one never showed a reconstruction consisting of the first latissimus dorsi flap, utilized to cover the defect of the incision.
Investigations. For the physical examination of the patient, she had a large spherical lesion that developed on her breast. It was divided into lobules with mass that measures 40 cm by 35 cm. Her nipple was below and in the middle of her overgrown breast, diverged and sinked in her skin. She had a huge lesion which was later discovered to be a phyllodes tumor without evidence of it being local or distant metastasis. Phyllodes tumor yields 0.5% of all the female breast tumor. It is defined according to the history and the development of the lesion. Therefore, her large phyllodes are 10 cm in diameter and they make up 20% of the phyllodes tumor. Her recorded breast weight is 8.27 kilograms. When using a microscope, the mass had compressed duct lines, two tired epithelium that are arranged in a cleft, and the abnormal growth of the stroma surround the mass. 5 mitosis per kilogram high power filter and predominantly overgrowing border without unnoticed malignant features. Her tumor had a minimum 4 cm clear surgical margin, and that is the reason the patient didn't get any therapy as there were no signs of malignancy.
Diagnosis. Mammography was not performed due to the size of the mass. Screening mammography is used to detect cancer early, before symptoms are experienced. This is when it is most treatable. In this case, mammography was not performed as the tumor had grown to a size that could physically be seen, indicating that the cancer was not in its early stages. Core needle biopsy procedure was utilized instead. In this procedure, a hollow needle is used to take a sample of breast tissue from the suspected area. The needle is either attached to a tool that moves the needle in and out of the tissue quickly, or it's attached to a suction device that pulls breast tissue into the needle. CT scan showed no metastasis. The mass contained compressed ducts surrounded by two-tiered epithelium arranged in clefts and excess growth of stroma arranged in a leaf-like structure. 5 mitoses per 10 HPFS were identified in the area with the most mitotic activity. Presence of a predominantly expanding border was observed. These observations, along with the biopsy results, indicated a diagnosis of borderline giant phyllodes tumor.
Clinical manifestation. It was found that the patient was 36 years old and had previously breastfed 3 children, but she also had history of 3 years increasing mass of her left-sided breast without feeling pain or having any signs of nipple discharge. The patient had no signs of weight loss, appetite loss, or any trauma. There were no past history experience on pylorus tumor in her family, or did she had any substance abuse history or records.
Etiology and epidemiology. Most cases of phyllodes are known, but they are more prone to women in their 40s and higher, with a very uncommon genetic disease called leishmania. Phyllodes tumors rarely affect men, but if it does, it's mainly men with gynecomastia. But there are breast tumors that begin in the connective tissue of the breast. These tumors cause pain and discomfort when they grow. Therefore, it is recommended to remove it via surgery, just like in our patient's case, a mastectomy. There have been reports that benign phyllodes tumors can really develop into malignant tumors, given that the benign tumor progresses at a slow rate throughout the years without any intervention. There are a few factors that research proves might be the cause of phyllodes tumors, such as breastfeeding, any type of triggering injuries, pregnancy, and elevated levels of estrogen. Sometimes these tumors can be felt as a lump under your skin and can cause skin discoloration around the breast. Our patient is a 36-year-old married Malaysian woman with 3 breastfed children. Noted with her medical history is a slowly growing left sided breast mass. The patient did not experience any pain, weight loss, loss of appetite, and history of trauma. She never smoked or drank alcohol previously. She had already consulted various traditional healers, but to no avail until she came to us for further management of the tumor, as she was finding it difficult to hide the large size of her left breast. Latin women and East Asians who were born in Central America have a higher chance of getting a phyllodes tumor. Further research has also suggested that phyllodes tumors have direct correlation with family relatives.
Pathogenesis. Phyllodes tumors form within the connective tissue of the breast. In this particular case, it is monoclonal, and where there are lesions due to either tissue damage or chemotherapy, the tumor is most likely to occur. Phyllodes tumors are fibroepithelial neoplasms. There are a few markers that are associated with the pathogenesis of phyllodes tumors, mainly being cell cycle proteins like protein 53, tyrosine kinase receptors, wingless or integrated pathway, otherwise known as WNT pathway, which regulates the gene transcription, which is critical in the differentiation between borderline and malignant tumors compared to borderline tumors. Matrix metalloprotease, and having the gene mutations of breast cancer susceptibility gene 1 and breast cancer susceptibility gene 2. Interaction of the epithelium and stroma initiates the formation of phyllodes tumors. Growth of the tumor leads to painful lactation, compression of the alveolar cells, as well as the compression of the lymph vessels, which could decrease the oxygen concentration within the organ, causing it to die and swell and change in color, as well as inflammation. Disease progression. The phyllodes tumor can progress to 3 different endpoints. It has the ability to create pathways to ensure its survival. It grows at a rapid pace and it is painless, although the consequences of the tumor can be painful. The tumor could either require surgery for recovery or be fatal if left treated for an extended period of time. Phyllodes tumors have the ability to create vessels, creating a constant supply of oxygen, blood, and nutrients, which ensures its survival. Based on microscopic characteristics, the tumor can fall into either 3 categories. It can either be benign, borderline, and malignant. Phyllodes tumors require interactions between the epithelium and the stroma, and these interactions are lost as the tumor progresses from one stage to the next. The tumor forms from lesions in the connective tissue. As the disease progresses, there are increases found in stromal proliferation, matrix changes, the inability of the stromal epithelium independence, the surface area of the skin that is stretched. Also, there might be occurrences of lumps. Volume of the organ increases, as well as the increase of the epidermal growth factor receptor. When the tumor is benign, it grows with a certain probability of recurrence and a great chance of recovery post-surgery. There is an increase in protein 53 expression within borderline and malignant tumors. There is also a deletion or a copy-neutral LOH in chromosome 13 in both borderline and malignant characteristics. When the tumor progresses from borderline to malignant, it has the ability to metastasize. This ability is promoted by heparin sulfate. When the tumor is identified as borderline, it is monitored with regular mammograms. This is to prevent the tumor from progressing to malignancy. A malignant tumor can result in death, whilst a borderline tumor is chronic. A malignant tumor metastasizes most commonly to the lungs, and may render inoperable, with only chemotherapy being the best chance at survival. With malignant tumors, it can either burst during an excision to determine whether if it is borderline malignant or benign, and then it travels up lymph vessels through to other organs.
Treatment. According to two previous cases regarding phyllodes tumor, one of the treatment methods including tram reconstruction, while in the second case there was no reconstruction. This was due to the fact that the tumor or cancer had invaded the chest wall, or there was direct invasion into the chest wall. Surgery is a common method of treatment for phyllodes tumor in the breast, but the best surgical method is debatable regarding benign tumors. In this case, with this patient, the recommended procedure was complete mastectomy coupled with reconstruction to ensure complete removal of the tumor. There are disadvantages and advantages of mastectomy. The disadvantages are it's a longer procedure. The procedure is performed over a large area. There's more post-surgery side effects and longer recovery time. There's a permanent loss of your breast. This is obviously due to the procedure being performed over a large area. There are also advantages. After mastectomy, radiation therapy can be avoided. Also, there is a lower local recurrence rate. This is due to the procedure being performed over a large area. Mastectomy is usually paired with a reconstruction procedure. There are a lot of reconstruction procedures. These include autologous latissimus dorsi flap, DIEP, and TRAM or TRAM. The autologous latissimus dorsi flap is an advantageous and a standard procedure. There are a lot of advantages with regards to this procedure. The advantages are there is minimum or minimal functional morbidity. This is due to the fact that muscles are harvested. There is a reduced risk of flap necrosis, low donor side morbidity. This procedure is beneficial for high-risk patients. These are patients with diabetes, they are obese, or they are smokers. This procedure also preserves aesthetics. This ensures mental or psychological health regarding physical appearance. There are disadvantages, however. The disadvantages include donor side seroma collection, but this is a short-term complication. On the other hand, there are long-term complications. That could be shoulder weakness, donor site pain, capsular contracture development in some patients. This usually occurs in patients with implants. In this image, it can be seen that the mass or tumor has been completely removed along with the whole left breast. It can also be seen that immediate latissimus dorsi reconstruction has occurred.
Discussion. Phyllodes tumors account for 0.5% in women with breast tumors. They can either be benign, malignant, or have attributes of both the benign and malignant tumors. Should the patient have a benign tumor, the best option is to remove the tumor via surgery. Even though malignant tumors can be cured by treatment, this does not take away from the fact that it can sprout back and therefore metastasize to other regions of the body, which will likely be the lungs. Phyllodes are tumors that grow repeatedly. Research has alluded that 85% of phyllodes tumors are benign and 15% are malignant. Mostly, phyllodes tumors are generally found in women from ages of 40 years and upwards. The phyllodes tumors are diagnosed by using an imaging test. The diagnosis can be made with incisional and excisional biopsy in order to determine whether or not it is malignant or benign. However, these tumors do not affect the breast cancer risk in question. Treatment of the phyllodes tumors include mastectomy, radiation therapy, hormone therapy, and chemotherapy. These tumors can reoccur after treatment. Therefore, follow-ups are mandatory and often frequent. In this case, the patient has an 8.27 kg phyllodes tumor and is accounted to be the largest phyllodes tumor, as well as the first latissimus dorsi flap utilized to embed a large defect catalyzed by the incision. Two cases of literature were reviewed, and these cases have disclosed information regarding patients with similar size phyllodes tumors that can be compared to our patient. The first patient underwent a transverse rectus abdominis myocutaneous flap reconstruction, and the second patient did not undergo a reconstruction as a consequence of a direct invasion into the chest wall. For our patient, we endorsed a total mastectomy to remove the entire tumor and an immediate reconstruction of the breast using the autologous latissimus dorsi flap. There have been methods that have been introduced, such as the transverse rectus abdominis myocutaneous, which is the tram, and the deep inferior epigastric perforator, which is the deep, with advantages consisting of low morbidity and low risk of flap necrosis. We further advise the mastectomy for the removal of a giant phyllodes tumor. A latissimus dorsi myocutaneous flap can be auspiciously used to supply an excellent aesthetic result for patients with similar situations, such as our patient.
Conclusion: even though the cause of Pylodes tumor is unknown yet, it is known that females are more vulnerable to the tumor even though it is a rare tumor. Mastectomy is the best treatment for Pylodes tumor of the breast as it completely removes the tumor, and it also reconstructs the breast by doing an implant under the flap. Thank you.